Okay, let's talk about Chapter 1, the Population Health Promise. In this chapter, we're going to be discussing a few items, and a big one's going to be the Affordable Care Act. In 2010, this Affordable Care Act was set in motion which involved many programs and initiatives aimed at improving the health of the U.S. population. We're also going to talk about in this chapter Population Health Promise. This is to help promote health and prevent disease. The National Priorities Partnership addressed 4 healthcare challenges: eliminating harm, eradicating disparities, reducing illnesses, and removing waste. Now, in order to improve the health of a population, there are quite a few things that pretty much need to take place. We need to increase insurance coverage to all. We need to improve access to care, making, establishments closer for individuals, maybe opening up an urgent care center in an urban area, things along those lines. We need to promote healthy behaviors. We also need to prevent illness. We need to coordinate care. We want to coordinate care between physicians. So if patient A is seeing 3 different doctors, we need to coordinate the care between all 3 physicians, so that way the care for the patient is going to be the best. We also want to manage chronic illnesses with teams of providers working in collaboration, of what I just said. We also want to make sure policymakers need to focus on evidence-based legislation. So we want to see what has worked, what's proven to work, and we want to put that information into legislation to say, okay, this is what we need to do in order to keep the population healthy. And also, population health holds great promise for creating an epidemic of health and wellness. So in this chapter, I'm also going to discuss some things I want you to learn, I should say. I'm going to explain the concept of population health. I'm going to recognize the need for population health approach to healthcare education, delivery, and policy. Also need you to understand how to understand the integration of the 4 pillars of population health, and also to utilize this text as a resource for further population health study and practice. All right, so now we're going to talk about population health. Population health is actually viewed as a promising solution for closing the key gaps in healthcare, insurance coverages, medical care, etc. The definition that we will use here for population health will be described as the distribution of health outcomes within a population, also health determinants that influence this distribution, as well as policies and interventions that affect the determinants. Now, population health has, some comprehensive agendas. The agendas can be the sick and the well, so the acutely sick as well as the chronically sick. We also want to focus on the clinical and the non-clinical, as well as the public and private sectors. Now, the fundamental goal for population health is just improving the health of the population, but the ultimate goal is healthy populations create productive workforces and thriving communities. Okay, so let's talk about the current state of population health. Right now, the U.S. healthcare system emphasizes a sick care system, the acute sick or the emergencies, such as when a patient comes into the ER, they're there to focus on that illness that the patient is presenting with, instead of going out to talk to communities and individuals to help prevent that illness from occurring to begin with. Also, if you look, despite 17% of the U.S. gross domestic product, or GDP, being spent on healthcare, our outcomes are lower than those of similar developed nations. Now, could this be because other countries are ahead of the U.S. and have universal health care? Some think so. Despite so much being spent, the public health system is still underfunded. Healthcare spending in the U.S. results in a healthcare system that does not perform as well as other developed nations. Now, many Americans are reporting not receiving the needed care or treatment. Well, in 2011, 14% said they didn't receive the needed medical care. Why do you think this is? Well, maybe they don't have insurance. Maybe they didn't have transportation to get to where they needed to go. 11% didn't receive the prescription drugs within the past year due to cost. And obviously this has always been a big issue, is the cost of prescription drugs. Remarkable disparities do exist. Based on the socioeconomic status, about 40 million Americans are still uninsured, while 112 million Americans, which is almost half of the U.S. population, suffer from at least one chronic condition. These chronic conditions can be heart disease, obesity, diabetes, tobacco-related issues. So the Affordable Care Act has brought about positive changes. However, it may take many years before the benefits are recognized on a population scale. It remains to be seen on what current administration will do with the Affordable Care Act. So obviously that's still kind of up in the air. as far as what parts will stay, what parts will go. But obviously there are some major issues right now in the population health world. Quality is suboptimal and the patient's safety must improve. 45% of Americans suffer from at least one chronic illness. And if you look at that, advances in science and technology have helped to contribute to increase life expectancy, causing an unprecedented growth in our older adults, causing new pressures on healthcare providers, payers, and communities. Now, chronic conditions require frequent monitoring and evaluation, which this also puts a big strain on the healthcare system. And then true population health equals emphasis on health promotions and disease prevention. Now, you can only achieve true population health by having an equal emphasis on these health promotions and disease preventions. So a couple of slides ago, we did discuss the definition of population health. Now, the determinants that they're talking about, determinants of health, include individual behavior, social influences, physical environment, medical care, public health policy, and intervention. Now, health determinants are varied factors that affect the health of individuals. So, for example, a person can be told to live healthier, which reduces the risk of lifestyle-related diseases like hypertension, diabetes, smoking diseases, but a person could have a family history of heart disease or live in an area where outdoor activities are unsafe or the air quality is poor. These determinants are kind of out of our control. So it's one thing to tell a person how to live a healthier life, but if their environment doesn't allow it, then that's a challenge and something that we need to work on in public health. Public health assumes overall health and well-being are influenced by interactions among determinants. These can be interpersonal, community, public. So at the interpersonal level, relationships with peers, family, and friends influence behavior. At the community level, institutional factors like rules or regulations that influence social networks. And at the public level, policies and laws regulate certain behaviors. And then population health outcomes can be improved by focusing on these determinants. So this is the second component of the population health definition. The general health outcomes could be improved by assuring access to quality health care for all populations regardless of insurance status, with the main focus on health, maintenance, and prevention. Now, population health is not the same as public health. Public health is a core element of population health that focuses on determinants of health in communities, preventative care, interventions, and education. So the main characteristic that differentiates population health from public health is that it focuses on the broad set of concerns rather than just on these specific activities. So population health efforts generate information to inform public health strategies that can be deployed in communities. Population health management gathers and analyzes data to identify issues, create awareness, and solve problems. Now, population health incorporates health delivery, health coverage, health access, prevention, screening, health promotion, and chronic care management. Now, the chronic care management care is actual care that focused on reducing fragmentation and unnecessary use of resources, preventing avoidable conditions, and promoting independence of health care. The promotion health promise encompasses health promotion, disease prevention, treatment of the ill, and then instead of seeking health care when sick, the aspirational model of health wants people to value their health and seek preventative care to stay healthy. Ultimately, the reward of optimal health should be the main driver in a culture of wellness. Okay, so now let's talk about the foundations of population health. The science behind population health. Health is a state of well-being. Population health provides a framework for the study of well-being and variability of populations. In the U.S., most of the health-related resources and attention is directed toward the delivery of healthcare services and is only one of many contributors to population overall health. Focusing on personal behaviors and health promotions, this is where health is improved by focusing on these behaviors and health promotions. Converting focus from one patient at a time to coordinated care across providers within the collective health of the population served in mind. Now, this is where it's needed to support significant and sustainable health improvements in the United States, delivering evidence-based care enhanced by the meaningful use of electronic medical records. Now, treatment of populations. This is defined as an increase in prevention and screening practices and improve adherence to recommended treatment. This can only be done with teams of healthcare providers cooperating. Now, chronic illnesses. Again, this is where almost half of Americans, about 45%, have at least one chronic illness. Management is the key priority in population health. Current strategies for helping people get well and stay well just are not working, driving costs and utilization of healthcare services, and threatens American progress in life expectancy. Greatest contributors to premature death from preventable chronic illness is patient behavior, which is about 40%, and this can include obesity and smoking. So in other words, the patient's behavior can help prevent a lot of these chronic illnesses, which obviously is a big strain on our healthcare system. Now, following 6 components of chronic care model, which would include practice care and practice improvement organization, clinical information systems, delivery systems design, decision support, self-management, and community resources. Now, this chronic care model is a model for guiding the development of effective programs to provide better chronic care to patients. The degree to which patients are informed and active is crucial to the improved patient outcomes. So more likely to learn self-management skills and to adopt healthy behaviors is kind of what we're looking for. So we just talked about the science of the foundations of population health. So now we're going to talk about the effect on and the response by the marketplace. So 60% of Americans receive their insurance through their employer. Now, businesses have sustained a substantial stake in their employees' health. As healthcare costs increase, employers are trying to find ways to decrease the cost to employee health benefits without decrease in quality. A healthier employee is more productive, misses fewer days, and so obviously employers are concerned with the health of their employees because it influences the economic health of the business. Prevention saves the company money is the bottom line. The workplace is a great venue to promote health and well-being since people spend most of their time at work. Employers lost 2 to 3 times the healthcare cost in decreased productivity. And then also workplace programs may be effective in promoting health behavior change, supporting self-care, assisting in the navigation of the complex healthcare system. And we're going to talk quite a bit more about these in future chapters, so we'll go into more detail about it then. Now let's talk about the politics in the foundation of population health. 3 steps toward making lasting changes in population health are building awareness, identifying population health needs, and recognizing importance of data measurements. So this serves as a foundation of the population health infrastructure. So if we can solidify these three steps, then making population health achievable is very likely. Now, also with the politics, we're going to start with policy generation at the local, state, and then national level. Attacking population-based concerns like obesity and smoking. Now, this healthcare workforce that will provide high-quality population-based health care in the future must be trained now. So obviously, if we want this to work in the future, we have to start training and putting this stuff out there. Education reform is underway to ensure the competency of future leaders and practitioners in healthcare, public health, business, and health policy. We need to also fund training and education of the next generation of providers. Research is needed to inform strategies to address population health approaches. Policies that support health and wellness will also contribute to the wealth of the nation. So, and also then finally, we need to also fund research to identify delivery best practice through innovation. So the frameworks for innovation include Healthy People 2002. Now, there are 4 overachieving goals within Healthy People 2020. The first goal is to attain high quality, longer lives. We also want to eliminate disparity, so we want health equality. We want to create healthy social and physical environments, and we also want to promote healthy behaviors. Now, the U.S. Department of Health and Human Services have been leading efforts to promote health and prevent disease by identifying threats and developing ways to reduce these threats. This is how Healthy People was pretty much developed. It's used by public health professionals to help drive community efforts based on the defined need. Also, it's used by population health as a roadmap to interdisciplinary collaboration that leads to shared responsibilities for health and wellness. Now, also in this frameworks of innovation is a triple aim, and we are going to talk a lot about this in future chapters as well. The triple aim is pretty much to help to increase the health of the population. We also want to decrease cost per capita, and we also want to increase positive experience in care. So the triple aim also provides an agenda for optimizing performance on 3 dimensions of care. Population is defined by enrollment or inclusion in a registry. To achieve triple aim, healthcare institutions and delivery systems must reduce hospitalization. We must also apply resources to patient care that are appropriate with their needs. And we also must build long-lasting relationships that are mindful of patients' needs. And then the last framework that we're going to talk about are the national priorities and goals, which obviously the National Priorities Partnership, or the NPP. The NPP is a partnership of 52 major national organizations with a shared vision to achieve better health and a safe, equitable, and value-driven healthcare system. The NPP envisioned a plan to achieve transformational change. So there are 4 key challenges that the NPP keeps in mind. They want to eliminate harm, they want to eradicate disparities, they want to reduce disease burden, as well as removing any waste. So the national priorities and goals, there are 6 national priorities that we're looking for here in population health. The first one is enable healthy living and well-being. Now, we also want to work with communities to promote wide use of best practices that enable healthy living and well-being. Also want to look at attack leading causes of mortality. So we want to promote the most effective prevention, treatment, and interventions practices for leading causes of mortality, starting with cardiovascular disease. We also want to be consumer-centric. So we want to ensure that the person and the family are the center of care. We also obviously want to promote safety. We want to make care safer. We want to be coordinated, so we want to promote effective communication and care coordination. And we also obviously need to be affordable. So we want to make quality care more affordable for all by developing and spreading new healthcare delivery models. Now let's talk about some preventative strategies. We must develop a commitment to incorporating population-based primary and secondary prevention strategies and to develop better care coordination for those suffering from chronic illnesses. Experts agree that focusing on primary prevention strategies, as example health promotion and wellness activities, will ultimately improve the overall health of citizens and decrease the costs associated with overmedication. So in order to improve the U.S. healthcare system, we must broaden our current focus beyond acute episodic healthcare. So we want to, talk about 3 lifestyle modifications, such as reducing smoking, eating a healthy diet with portion control, as well as exercise regularly. By doing this, it helps to promote early detection of disease. So we want to seek to reduce barriers to early treatment and completion of therapy, thus improving health treatment outcomes and reducing chronic disease. Now, a secondary prevention, such as screening, would include cancer screenings, blood pressure checks, cholesterol checks, and then also wellness exams. So the main reason for the secondary prevention would be to minimize disease complications and comorbidities. This is critical to reducing healthcare costs. So if we can get ahead of these type of diseases, cancer, high blood pressure, high cholesterol, if we can get ahead of that as far as with healthy living, healthy eating, then we can definitely decrease healthcare costs. And then a tertiary prevention would be to minimizing disease complications and comorbidities, as well as coordinating and providing continuity of care for chronic conditions. Okay, so now we're going to talk about the 4 pillars of population health. They are care management, quality and safety, public health, and health policy. When talking about care management, it must be improved across many settings where care is delivered. Clinical management and self-management must be promoted. Access to screening and counseling is essential to successful treatment for chronic conditions. And then also treatment decisions need to be made jointly with patient and provider, such as education. Patients need to understand their disease and what their treatment options are in order to make a very well-informed healthcare decision and stick with their treatment. So if the patients aren't sure what they're supposed to be doing, then they're really not going to probably follow the path they're supposed to and thus not become well anytime soon. So now we'll go to the quality and safety pillar. Here we need improvements rely on activated patient and provider teams. So these teams must be motivated to examine the structure or design and organization of healthcare delivery and change the processes or workflows that are leading to errors. So obviously, if teams can work together, they will have a lot less errors for the patient towards their recovery. Quality and safety also need to design and modify processes to make delivery safer. We also need to promote a system-based approach. Now, To Err is Human is actually an important text by the Institute of Medicine. This came out in 1999, and it consists of best practices and makes recommendations on how to design systems and processes to make healthcare safer. On this slide, we'll talk about the last two pillars of public health and health policy. So the public health pillar are going to talk about health determinants, health disparities, as well as disease burden. Now, these are going to be pretty much community-wide concerns. This pillar provides a framework for identifying these health determinants, health disparities, as well as disease burden. Then this pillar also implements strategies to address community-wide health concerns. Now, as far as the health policy pillar, these which will be pay for performance, transparency, and accountability. So the pay for performance is a policy support that drives adoption of community-wide quality and safety standards. This pillar also makes comparison data available for other healthcare constituents and consumers. So in other words, they want to show transparency on that. That way there's nothing hidden. Everybody can see exactly what they're looking for. And then also it will create a sense of accountability, for performance and a drive for improvement. So in conclusion, we are to improve the health status of American population. In order to, we must shift the healthcare system from reactive to proactive. We need to promote health and wellness. We also need to have an increased understanding of what must be done. We have the understanding of what the needs are, but a population health action plan has yet to be established to address them. Knowing is not enough. We must apply. Willing is not enough. We must do. And that quote was from a gentleman by the last name of Goethe. We also need to require collective efforts of many to really create this need of change. And then also, this whole population health is a call to action. We need to know what the issues are. We know what the issues are. We must now go and fix them. This is a call to action for all healthcare professionals. So this concludes Chapter 1. And if you have any questions, please feel free to let me know. Thank you.